Hi, good evening. Today I'm going to talk on about the technical topic, that is data and collection and the analysis in the clinical research. So, what is the data collection and analysis? It is data collection and the analysis are the two of the most critical parts in the clinical research, determining the quality, reliability, interpreting impact to the findings. So we will start with the first data collection in the clinical research. What is the data collection and what is its purpose? The data collection is the systematically information uh, gathered from the relevant patient of relevant informations related to the patient outcomes, interventions, and variables which that are hypothesis or evaluate the interpretations. So type of data collected, that is the demographic of the patient, means age, age, gender, status, what is its second, medical history, patient illness, surgeries, family history, clinical data, means that lab results, images of vital signs or signs of any disease progressions, in treatment first, which any other treatment taken, medications, doses are we are continuing. So if the continuing, what is the durations of the dose, then outcome of the patients. This all the types of data is collected. So what is the collection method of data? It can be a, there are various method. It can be a electronic case form, um, case report form, that is. Then automated extractions of the hospital system, patient diaries and diaries and surveys, um, biological samples which we collected, that's report. So good data collection, there is a GPC, it's known as the good data collection practices. So what is it? That is the standardization using the valid tool and tools and the protocols, training collectors, data security and the privacy compliances. There is an informed consent also from the patients, if they are if, for example, if we are getting doing the trial on any patient, their consent should be important for that. This is about the data collection. Now, what is the data analysis? In the clinical research, data analysis means the simplest to interpret to interpret the data collected to determine if the research is hypothesis in the supports, and whether the result are systematically in clinically meaningful. So how we can analyze the data? That is data cleaning, data statistics. Then there are any other data, survival analysis, which are comes in the time of the events. Then in data cleaning, handling that the missing data, we some errors got, and then it's statistical, summarizing the baseline characteristics. Mm, these are the steps of the data analysis, how we can data analyze that. So what is the tools we tools and the softwares which we used, that is in clinical research, which I have done, that is the REDCap. One is that open clinical data captured and management. It is full form, that is research electronic data captured. It is the REDCap. Then this one only I know that how, what is the tool, and this tool I know that software, how to analyze. So that is the, in clinical analysis, that it comes the validation studies ensure that the accuracy of a measurement tool, randomizations and the randomizations and what we see, the blinding help to reduce the risks. And then what we, these are this is only in the clinical data analysis. That is means that the high quality data collection ensure that the subsequent analysis is truthworthy, or meanwhile it is statistically analysis allow to research to draw valid and reproducible conclusions, which ultimately drives the medical advancement and the evidences based practice. So that's why it is used, the clinical data management and clinical data analysis. These are the difference between the clinical data management and the analysis.